Fotona procedures are very safe. The smooth is intrinsically safe, so I don't have any complaint about the Fotona laser use in my patients. And I did understand on the field what Fotona smooth means for the treatment of the mucosa. And now that I improved my Fotona laser use with a neodymium YAG, I do understand what piano means for the physician. And that I see the possibility to use both energies, and the use of both energies, both in vagina, for the facelift and whatever, is of help a lot for women. So after the use of Fotona lasers in few patients, I did realize right away that these procedures are very safe, very effective and rewarding, also in terms of from economical point of view.
Yeah, so look, has laser changed my practice? Absolutely. You know, I think, you know, and as a trainer and getting trainees from all around the world coming to the hospital I work in, I always say to them, look, to be a good, well-rounded clinician, you need to be good or have a knowledge, certainly, of all aspects of treatment and investigations and the way we look after our patients. So for me, you know, you need to be able to offer everything to be a good urogynecologist, and laser for me is another option, you know, outside of surgery.
Well, you don't have to buy consumable materials afterwards, and I like it very much. So that gives the doctor many choices in the future, so that you don't have to pay a lot of cost when you try to marketing these procedures. So I think without or very limited consumable materials is a very important advantage for Fotona laser platform.
Fotona laser is definitely my choice because it's established worldwide. And from my experience, I'm a happy user. I'm very excited to have my second unit installed very soon.
Well, as a laser gynecologist, what can I say about what is the most important contribution lasers have brought to my professional career? One, I would say that working with the high-tech quality of technology really helped me in the past and now in the present to differentiate my practice, to have the possibility to offer to my patients high improvement in their quality of life that cannot be achieved with any other tool. So lasers, in particularly this Fotona smooth non-ablative laser, because I have experience using other types of lasers in the past, but the use of this non-ablative smooth mode really helped me to grow professionally, to give me the possibility to create protocols for my patients and to share these protocols with colleagues from worldwide, but mostly to improve my patients' quality of life. I'm not talking about only aesthetics, I'm also talking about regenerative gynecology, functional gynecology, when we talk about urinary symptoms, pelvic organ prolapse, genitourinary syndrome of menopause, among others, list of problems.
I find that you can achieve a very high success rate. I would say above 90%. It has been my personal experience, and the patients will come back and they will do their maintenance and they will do their sessions year after year.
So that's how I started it off. You know, it was a walk-in, walk-out treatment. It was painless, bloodless, no anesthetic required, no infections, and most importantly, no complications really. And that, of course, then we entered into the mesh disaster and all the complications that were being litigated against doctors because of that. So women, of course, are very educated, obviously, and looking at Google and everything else, we're coming in saying, well, I don't want that mesh thing, you know. So again, that's where the laser provided a great opportunity for a different way.
I begin to work with very effective method which give me the opportunity to help my patients without operations have a very good result.
Ну, их нет. Мне трудно представить, как это вообще возможно при такой технологии, как СМУС. И благодаря этой технологии мы можем достичь вау-эффекта за одну процедуру. И подтяжка, и лечение, конечно же, сужение влагалища, его восстановление, и, конечно же, красивая, подтянутая, помолодевшая кожа наружных половых органов. И это особенно нравится каждой женщине, которая прошла процедуру, потому что на это она обращает больше всего внимания. Это первый эффект, который мы сразу можем получить, увидеть его, оценить, как специалист, так и пациент.
Yeah, I think the most obvious thing, and the reason I looked at laser, was particularly for the treatment of stress incontinence. So incontinence has been a really big part of my practice. I have a huge number. If you look at kind of general demographics and prevalence figures, probably about 1 in 2 women suffer from some form of incontinence at some stage in their life. So it's really prevalent. But what is startling for me is renovalaise. So a lot of genital urinary syndrome, menopause, GSM, menopausal symptoms. What I see a lot of is older women post-menopause who suffer from recurrent cystitis, recurrent urinary tract infections because of vaginal atrophy usually. And it's been really effective for those women who are really a difficult group to treat, because you just end up throwing prophylactic antibiotics for 6 months at a time at these women to try and eradicate the cycle of infection. So I've really found renovalaise fantastic for that. Yeah, look, it's funny. I think whilst it initially became, or incontinence was the primary focus for me with laser, it's really diversified into the other areas.
Fotona SP Dynamics had helped me a lot in my practice. It helped me to differentiate from other aesthetic doctors. I've started my setting as an aesthetic doctor, so with Fotona SP Dynamics on board, I'm not treating my clients only their face, I also help them to rejuvenate their vagina. So it helped me to differentiate other practice. With this, I'm a happy user, and I definitely will recommend to other of my colleagues.
I started working with the laser in 2013. In the last 7 years, I saw that my practice enlarged a lot in implementing the use of laser for the treatment of genital urinary syndrome of menopause, incontinence, and the vaginal relaxation. I mean, with the laser, we can help women that cannot help in other ways. I'm explain myself. In women that they suffer from mild, moderate stress urinary incontinence, that they cannot be put in the operating room right away just because the condition is not so severe, they are condemned to use pads. I mean, pads is not the cure. Pads can be a remedy, but it's not a cure. With the vaginal erbium laser, with incontinence, with intralaser, we can solve some clear problems for our patients, and we can help them a lot.
Well, introduction of Fotona lasers completely changed the profile of our practice. Having all the lasers is extremely useful, because when a patient comes with one complaint, they usually surface more of their complaints, not only in the area that they came with the complaint, but also in the other areas. So I cannot be more happier that we made the decision 7 or even 8 years ago to start with the gynecology treatment of laser treatment of gynecological problems, because now we are treating all sorts of problems in all domains.
So Fotona laser is one of the core platforms in all of my 10 laser centers located in Taiwan or Texas. Fotona Dynamics SP is the platform that I usually choose for my centers. Among many procedures that could be offered from the platform, vaginal rejuvenation lasers procedure and also the facial lifting procedures by the anti-yaw laser And intraoral laser is the most popular procedures I could say in my centers.
After 10 years using other technologies, in particularly CO2 in gynecology, I was looking for something less aggressive because I was completely convinced that being less aggressive, we could achieve even better results. And that was my main concern, to have the possibility to improve my patients' quality of life with a less or a non-aggressive tool. When I found Fotona in a Congress, I definitely didn't think for 1 second. I decided to buy the laser.
The best thing about Fotona is that it's really smooth. This is really a gentle therapy, and it's a perfect way of treatment and this is one of the most, I can treat one of the most severe syndromes of menopause, and this is the atrophy. Because every woman who has atrophy will complain, sometimes loud, sometimes not, depends on the doctor asking her or treating her. So this makes my procedure so convenient, because it is without pains, it is very easy to go, it is very friendly to the patient, yes, and 5 to 6 months later, you have the height of the results, and this the patients are appreciating it. They are calling me without, they don't need anything from me, but they just want to thank. They want to tell me, look, this is the best thing I ever invested in myself.
那么我们讲，我们在做这个耳激光治疗的时候，大家可以知道，耳激光是一个非剥脱性的这个激光，所以它对这个黏膜组织几乎是没有损伤的。在治疗期间，我们的感觉就是病人的体验也非常棒，几乎没有任何的这个疼痛。在至今我们治疗到现在的这个病人当中我们的确没有碰到过任何严重的并发症病人的体验都非常好，这个治疗的效果呢，治疗的这个过程呢也是非常的棒而且是非常安全。那么特别是在这类人群当中我们选择的最多的还是产后的那些年轻的女性。那么为什么呢？主要是由于这些女性产后的这些女性，她的这个要求中激光我们可以讲更微创、更快速这个更有效的治疗的这个心愿就非常迫切她们这个有时候没有时间去做这样的盆底的康复的理疗，去做这个盆底肌的训练，她们希望能够更快、更迅速的来治疗这样一个尿失禁。
I bought Fotona SP Dynamis. It was important for me that I got 2 types of laser technologies, erbium and neodymium, within one device, and I could work more than 100 kind of settings. It was also an aspect that the distributor who described the equipment was highly qualified in terms of medical and engineering training, so I was able to get the right answers to all of my questions.
I worry a little bit about the energy-based device treatments in vaginal work, because a lot of companies wouldn't have the same ethos and dedication to research that an established company like Fotona has. And clearly your long history, was it 40-50 years in laser technology, stands to you, but that was so important to me to deal with a company that has that reputation. Getting another laser is definitely on the plan. Again, it's one of the things that really impressed me with Fotona is that the LAHA, that's what you refer to it as, the Laser and Health Academy. So there is a dedicated academy of clinicians and users that talk a lot, exchange ideas a lot, and meet regularly. There's a formal meeting at least once a year, I think. And there are workshops, and everyone has to go, any end user has to go to and receive a certificate in laser knowledge, which is really important because as clinicians and medics, we might pretend we know a bit about laser, but we don't, and I learned a huge amount when I went out to that meeting in Slovenia, and you need to have that background knowledge before you start offering this treatment.
Well, there are all sorts of lasers now out there, but my rationale was that Fotona lasers are extremely safe. And safety is what we should strive for. And the other thing is that they had extremely wide indication area, where one laser, for example, SP Dynamis, can be used for all sorts of problems. That means with purchasing as the first laser, SP Dynamis, you can solve your patient's problems in the very safe mode. So that was my rationale. The other thing was that once you purchase, let's say, SP Dynamis, then it very rarely has any problems, and the Fotona team is always on hand so that they can come, and you feel very safe as a proprietor of a practice.
The decision to purchase the Fotona came after I've checked all existing systems provided. Now, Fotona was the only one, definitely the most user-friendly, and especially the support. The support was very, very important for me, because I need the support. I need to know that somebody is behind me, and I have it. And I didn't gain only a way to make good living or to satisfy my patients. I got friends where I know I will always have a support when needed. You see, I needed them today, they came. We have holiday in Austria. And they came, all of them. Because this, I think it is very important, because it's not cheap, but it's the best thing I've ever purchased, ever.